Hi, I'm Amanda Johnson. I'm a psychologist here at Capstone, and I am the clinical director. So I manage all of the therapists and psychologists that people meet with when they come to Capstone. I've been at Capstone since 2013, so about 7 years. And before that, I was at the Poweshiek County Mental Health Center in Grinnell for a few years. I graduated in 2010 from the State University of New York at Buffalo with my PhD in counseling psychology, but I grew up here in Iowa, so I'm happy to be back here practicing close to my family. Today I'm going to talk to you about a really important topic in mental health so that you can learn a little more about some serious mental illness. I'm going to go ahead and share my screen with you now. And today we're going to be talking about serious mental health diagnoses. And it is the fourth part in a four-part series. So some other diagnoses have already been covered, some more common things. Now we're going to talk about some less common things, but still some things that are really important to know about because they can impact people and families very much. So today we're going to be talking about schizophrenia and personality disorders. So schizophrenia literally means fragmented mind. The brains of those people with schizophrenia are actually physically different. So it is one of those mental illnesses that we can actually look at the brain and see how it is different from other people. If you look down in the right-hand corner of your screen, you'll see some brain images of a pair of twins. And the twin on the left has a healthy brain, and the twin on the right is someone who's been diagnosed with schizophrenia. So as you can see, there's some dark areas there which would indicate some open space in the brain. So parts of the brain have deteriorated compared to the other parts of the brain. It is not extremely common. About 1% of the population meet criteria for diagnosis of schizophrenia. So if there are 100 people in a room, one person on average would be diagnosed with schizophrenia. But if you think about the world population, that is a lot of people out in the world who are living with schizophrenia. The symptoms of schizophrenia exist on a spectrum and can include various different things. There is a class of symptoms known as positive symptoms. So these are things that are added to what a person normally would display. And these can include things like hallucinations. And hallucinations can be auditory, like things we hear. They can be smells, things that may not be there, but that we smell. They can be visual, things that we see that aren't there. And they can even be tactile, or things that we feel that touch us that aren't actually there. In addition to hallucinations, a person can experience delusions, and those can be many different things. They can be things that seem very unrealistic, like a person imagining that they're Jesus, or that they are a mythical creature. But they can also be things that seem potentially believable, like the FBI is investigating them, or someone is monitoring their phone lines, or many things like that. They often will demonstrate some disorganized speech. So they may say sentences that don't sound like they mean anything to the rest of us, but they are presenting like it means something to them. They can exhibit some pretty strange behaviors, like writing large amounts of text in a notebook that doesn't seem to make sense, or just doing things that don't seem like they're ordinary to us. And they often have trouble with concentration. There's also negative symptoms. So negative symptoms would be things that are kind of taken away from our normal functioning. So that would be someone who's withdrawn and lifeless. They may not have any facial expression. They may not be talking or responding to anyone in a way catatonic. They might lose interest in things that they normally would enjoy doing. They might have little or no facial expressions, and they might be demonstrating a lack of motivation and not participating in their life in the way that you maybe had noticed them doing that before. And schizophrenia really exists on a spectrum, so it can include some or all of those symptoms, and they can change over time. So just a little bit, without getting too sciencey, about what causes schizophrenia in the brain. It really is an imbalance of a chemical in our brain called dopamine. So when people are experiencing those positive symptoms, they are having too much dopamine in their brain. And when they're experiencing those negative symptoms, often it's because they have not enough dopamine. So the brain is imbalanced, and that is what causes those symptoms that we see. Scientists don't exactly know for sure what causes it as far as why someone would develop it versus someone who does not. They've had some clues. Some research suggests that it's genetic because some families tend to have more people in them that are diagnosed with schizophrenia than others. Some scientists believe that it is induced by large amounts of stress, and we saw some of this in the Vietnam War, where the incidence of schizophrenia in that population was higher than their same aged peers, and they believe that it was related to the amount of stress being in combat exposed the veterans to. There's also some thought by some scientists that it's caused by early environmental changes like pollution or trauma to the mother while she is pregnant with the child. Who's diagnosed with schizophrenia? Generally, it is individuals between the ages of 20 and 38, and it's oftentimes 20 and 38 for males, but 20 and 32 for females. Slightly more men are diagnosed than women, and it's most common to be diagnosed in late adolescence or early adulthood. So we see a lot of people coming into our offices that are diagnosed around the time that they would be heading off to college, which is already a very stressful time for people. And it's also the time that they're often leaving their homes for the first time. So they're off living in their dorm or their first apartment, and they start to have these symptoms when they're kind of in isolation. So that can present some difficulties in terms of diagnosing and getting the right treatment to people. How do people get diagnosed? Well, a lot of times it's an assessment by a therapist, a psychiatrist, or sometimes a primary care doctor. They ask a lot of thorough questions about the symptoms they're having, family history, and other biopsychosocial factors. It has to be someone who has the proper training to recognize schizophrenia and the symptoms that go along with it. And sometimes a doctor or therapist will refer someone to get some psychological testing. There are a couple of tests that monitor for symptoms of schizophrenia, and those include the Minnesota Multiphasic Personality Inventory, or the MMPI, and the Milan Clinical Multi-Axial Inventory, or the MCMI. And we do both of those here at Capstone, and a lot of psychologists out in the community also offer those tests. So what are the treatments for schizophrenia once we know someone has had them? It could be medication. So they have medication in the forms of pills, as well as long-acting injections, where a person might only have to take an injection once a month. In addition to medication, there are also various kinds of therapy that can be helpful for people with schizophrenia. That includes cognitive behavioral therapy, individual therapy so that they can get some support to deal with the difficult things that are facing them. It can be group therapy where they learn to interact socially with other people, because that can be a real challenge for people with schizophrenia. And other times, therapy might be focused on job skills and getting them back out into the community. So what does it feel like to have schizophrenia? I'm going to show you a really short video clip starring Anderson Cooper, where he does some different things to see what it's like to live with schizophrenia.
Whispers and voices in my head, and the first test is some number puzzles.
You suck, and they know it. Did you get this right?
Okay, so I did this test for 3 minutes, and I did not get a single one. It's very hard to concentrate if it's like music or something constant, it's easy, but people talking to you is very difficult. So now I'm going to be asked a series of questions by our producer, Susan, and these are basically a series of questions that a person would be asked and they were being admitted to a hospital.
Can you tell me what day it is?
Yeah, it's Sunday, June, I don't know, what's the date, 7th?
So I'm going to say 5 numbers, and I want you to repeat them back to me after I'm done.
Okay.
5, 23, 67, 2, 76.
5, 23, 67, something 76.
I'm going to say 5 words. You don't have to repeat them, but just listen to them. Cat, book, cigar, damage, and rain.
Make you okay.
Can you name the last 4 presidents of the United States?
Okay for you to be
Barack Obama, George
Come
Bush,
here, here, right here.
Bill Clinton, and George Bush.
Here.
So those 5 words I said before, can you remember any of them?
No. It's hard because sometimes voices are like whispering, and sometimes they're aggressive, and sometimes they're kind of comforting. And
Here's the treat.
again, with people kind of talking to you all the time,
It's okay.
it's hard.
Don't worry. An hour later,
So I'm going
don't
to try to
worry.
make a boat of
All right.
origami following these instructions.
Hey, it'll be okay. Near, near, get near.
Shut up.
I want to talk back to the voices now, but it's really distracting. It's,
Do not touch that stuff. You suck. What are you looking at? This is easy. You want to touch that?
I can't do this.
Hand down. Keep your eyes down. Just do it. Filthy mind. Leave it alone.
It's also frustrating because they're telling me I can't do it, and so I didn't do a very good job with the boat. But it's really hard to focus when kind of people are whispering to you and talking to you.
Just come clear. Come near to me. Come near for help.
Hey, do you have yesterday's paper? Yesterday's New York Times? No? Okay, I'll just get today's. It's incredibly distracting on the street to have somebody talking in your head, and it makes you feel completely isolated from everyone else around you, and you don't want to engage in conversation with other people. You kind of find yourself wanting to engage in conversation with the voice in your head because they're constantly being really negative and talking to you, and everything they're saying relates to things that you're actually doing. They're criticizing things you're doing. It's like it's like you have a chorus watching you and commenting on what you're doing, and you can't help it. I mean, I literally find myself wanting to kind of respond to them, kind of tell them to be quiet, and it's incredibly unpleasant. This is a very, very unpleasant experiment. It's really, it's eye-opening because it kind of really shows you what other people must be going through who deal with this on a regular basis. But also, like, I cannot wait to take these headphones off because it's really depressing. It's very negative. It makes you feel very, very negative. Yeah, it's very creepy. I want it to stop.
Eyes down. You back up. Stand up now. I'll count you off. I'll count 20, 30, 40. Stand up now. Walk away.
You're okay.
Walk now.
Pacify. Pacify. On to pacify. All the way to make it home.
I'm going to put these earphones.
So that was Anderson Cooper experiencing some symptoms of schizophrenia. He was mainly experiencing auditory hallucinations, but you can see how difficult that would be for a person to go through their daily life, hearing those voices all the time. And sometimes it can make it very difficult to concentrate and to appear like a normal person. So that is just to give you a little glimpse on what it might be like to experience schizophrenia. So there are a lot of impacts both to the individual and society being diagnosed with schizophrenia. People with schizophrenia may have a shorter life expectancy. On average, they live 14 years less than their same age peers. They're more likely to suffer with physical health problems such as cardiovascular disease, And it costs society a lot as well. The cost to the US in 2015 was $210.5 billion. It costs money to the criminal justice system, healthcare system, because of homelessness, and due to suicide. So the next disorder we're going to talk about is a family of disorders called personality disorders. These disorders are a little bit different than schizophrenia because they don't develop because of changes in the brain. They develop due to some other situational factors. So a personality disorder is someone who's suffering from the personality disorder, rather, is an individual who's experiencing unhealthy patterns of thinking, functioning, and behaving. A lot of times they have different ways of thinking about themselves and other people. Their emotions can be different. The ways that they respond to things emotionally can be different. They have different ways of relating to other people, and they have different way of controlling their behavior. And a lot of times people who are suffering from personality disorder behavior deviate from cultural norms, causes them or people in their lives distress, or impacts their functioning in a negative way. There are many types of personality disorders, and there's a list of them up on the screen now. So I'm going to tell you a little bit about each one of these just so you can get an idea for what kinds of personality disorders there are. So the first one on your screen is antisocial personality disorder, and that is a type of personality disorder that leads people to violate the rights of others, disregard rules. They often don't conform to social norms. They may repeatedly lie or try to deceive others, and they may act really impulsively. This type of personality disorder is more represented in the criminal population than some of the other personality disorders. On the extreme end, it might be someone who engages in severe crime, but not always. All of these exist on a spectrum, much like schizophrenia. The next one on the list is avoidant personality disorder. So this would be a person with a pattern of being really shy and avoiding people and things. They may feel very inadequate. They may be very sensitive to criticism. They may be really unwilling to get involved in things in life and just very avoidant, like the name implies. The third one on the list is borderline personality disorder. Borderline personality disorder is a pattern of emotional instability, relationship instability. They have a very difficult time with intense emotions. They often will also go to great lengths to prevent themselves from being abandoned. And they often have self-harm or suicidal tendencies. The next one on the list is dependent personality disorder, somewhat the opposite of avoidant personality disorder. Dependent personality disorder would cause a person to really need to be taken care of, to be overly clingy, needy, needing reassurance from others on a daily basis, being really uncomfortable when they're alone, and a fear of not being able to take care of themselves. The next one on the list is histrionic personality disorder. A person with histrionic personality disorder might have a lot of attention seeking. They may have excessive emotions. They may get really worked up over things that don't seem like they should cause a person to get that worked up. They also might have very flashy personal appearances or do many things to draw attention to themselves. The next one on the list is narcissistic personality disorder. It's a pattern of needing validation from other people, feeling like they're really important, feeling like they're entitled to things more so than other people. They often take advantage of others, and they have a lack of empathy for other people oftentimes. The next one on the list is obsessive compulsive personality disorder. So this is a person who's very preoccupied with order and details and things needing to be a certain way. They can be very inflexible in their morality and their values. And unlike obsessive compulsive disorder, which might have been talked about in the anxiety disorders section, this is very much a part of a person's personality and doesn't change as much with anxiety levels increasing as obsessive compulsive disorder. It is really a fundamental part of their personality. Paranoid personality disorder is a pattern of being suspicious of others and paranoid that they might be coming to harm or that others are trying to deceive them. Schizoid personality disorder is someone who is detached from social relationships, doesn't have a whole lot of emotion, doesn't seek close relationships, chooses to be alone, and seems not to care about whether a person praises them or criticizes them. They're just very detached. And then last on the list, schizotypal personality disorder is someone who is very uncomfortable in close relationships, might have very eccentric behavior, distorted thinking, have odd beliefs or odd behaviors, speech, things like that. So those are very short descriptions of the personality disorders listed on the screen. We could probably do a presentation on each one of these individually. That is just a very broad overview. So what causes personality disorders? They are caused oftentimes by early childhood trauma, abuse, or neglect in childhood, and they also believe that there is some genetic and neurological factors that are related to why a person would develop a personality disorder versus other people who do not experience the same circumstances. Most of the people that I see with personality disorders in my office are people that have had a trauma in their childhood or not received the interaction or lessons that they needed from their parents, and are now struggling as adults to figure out how to navigate relationships and their emotions because they don't have the knowledge to do that. Diagnosing, much like with schizophrenia, requires an assessment by a trained mental health professional and thorough questions about their symptoms, their family history, and other biopsychosocial factors. We can also use personality testing to diagnose personality disorders, and that would be both the MMPI and MCMI that I mentioned earlier. Treatments for personality disorders are a little bit different. So we rely on a lot of therapy techniques to treat personality disorders because they're a part of who a person has developed into. So it often takes things like psychodynamic therapy, which is involved in kind of exploring a person's upbringing and how the person they are now connects to that upbringing. Dialectical behavior therapy, which is a type of therapy that helps to teach the skills that people who have personality disorders haven't gotten as they were growing up. Cognitive behavioral therapy, which works to change a person's thinking. Group therapy, so they can learn to have relationships and problem solve with others. And psychoeducation, which is about really just teaching the individual and the family members about the illness and ways of coping. What about medications? So that wasn't first on the list there for treatments. The reason why is because no medications are specifically designed to treat personality disorders. Because they're a part of how we act and who we are, a medication doesn't necessarily help with that. It's learning new ways of doing things that really makes lasting change for people with personality disorders, and that's done in therapy. There are some symptoms that can be managed with medication that are a part of a personality disorder, like depression, anxiety, or mood instability. And that would be something that a person would have to talk to a psychiatric medication provider about to see if there was a medication or medications that could help them with some of the symptoms of personality disorder. So what can you do other than going to see a therapist or a psychiatrist if you think that you or someone you love has one of these illnesses? So obviously, as I said, the first one is to consult with a mental health professional, whether that is a psychiatrist, a psychologist, a social worker, mental health counselor, or even a primary care doctor. It's important to get someone to treatment so that they can be diagnosed properly and get the right recommendations as early as we possibly can. And it's important that people who have diagnoses of both of these categories of disorders, as well as any other mental health disorder, follow treatment recommendations. They take medications like they're supposed to, and they follow through with therapy. That is the best way for people to overcome these diagnoses and lead successful, happy lives. But things that you can do outside of that include planning for when symptoms may be worse. So there are going to be times when symptoms have subsided, even for people with things as severe as schizophrenia. And during that time, when their mind is clear and they're able to make some plans, it's a good idea to plan for a time when the symptoms might be more severe. What's going to be done with your children, or who's going to take care of your pets? What hospital would you like to go to? What treatment plan would you like to follow? And make sure to let those people in your life that are your support people know what that plan is. It's important when you're able to learn about the condition as much as you can, so you can understand what's going on with you or a loved one. Staying active is really important. So those chemicals that we talked about earlier that get imbalanced in the brain can be more regulated by getting physical activity. It also helps us feel better physically and can help us feel more confident if we're in better physical shape. Avoid drugs and alcohol. Even though it may seem like those things help, they actually generally increase symptoms and make them much, much worse. And then you also are dealing with a drug or alcohol addiction as well as having a mental health issue, and that is fairly common. Get routine medical care. As I said earlier, with people that have severe mental health illnesses are more likely to have serious physical conditions like cardiovascular disease and diabetes. So it's really important that you take care of your physical health as well as your mental health if you're struggling with one of these diagnoses. Join a support group. It's really helpful to be around or talk to people who understand what you're going through. And so a support group is made up of other people that may have the same diagnosis or know somebody with the same diagnosis, and it can help us to feel like we're not so isolated and alone. So a support group can be a really important part of a recovery process for someone. Write in a journal to express your emotions. So if you aren't necessarily comfortable talking about everything that's going on in your mind or what you're dealing with, a journal can be a way to express that and get it out without having to share it with someone. And you can always share some of your journal with others if something comes out there that you would like to share. Try relaxation and stress management. As we said, with schizophrenia and as well with personality disorders, stress can be part of what causes a person to have more symptoms of these diagnoses. So learning to manage stress is really important. And the last thing on the list there is to stay connected. And that can mean to friends and family, to your church, to your mental health professionals, but it's really important that you don't isolate yourself and that you reach out to others so that you can get support. It's one of the things that has been found to really help people overcome the challenges of having a severe mental health diagnosis. Some other resources outside of that is the National Alliance on Mental Illness, or NAMI. They have a great website with some really great resources. They also have a local chapter in Jasper County that offers a lot of great things, and they can be found by Google searching NAMI in Jasper County, or you can check out the national website. They're listed there as well. There's also SHAMSHA, which is the Substance Abuse and Mental Health Services Administration, or the federal government office that deals with substance abuse and mental health. And their website also offers a number of really great resources. And if things get really difficult, you can always reach out to the National Suicide Hotline at 1-800-273-TALK. And you don't have to just be suicidal to call that number. If you're having a really difficult time and you need somebody to talk to, that is also a number you can call. And locally, if you reach out to us here at Capstone at 641-792-4012, we can oftentimes get you in for an emergency appointment during the day, or if it's after hours, there will be instructions on the phone to how to be connected to a 24-hour crisis hotline that is located in Cedar Rapids. And they can even page out someone from Mobile Crisis sometimes to help you if it's clear that that's needed. So there are a lot of really great resources if you or a loved one is struggling that you can use. And I hope that I've given you some information today that can help you or a loved one deal with severe mental illness. But if it's just brought up more questions for you, we're here to answer them and here to support you and your family get through any difficult times you might be experiencing.